Greetings and welcome to my channel. This is Paul Karitsis, and today I'm going to give you a short history on hypnosis. But first we will recourse to a operational definition of hypnosis before we go into history. And the definition that I like best comes from Killstrom. He describes it as a social interaction in which one person, designated the subject, responds to suggestions offered by another person, designated the hypnotist, for experiences involving alterations in perception, memory, and voluntary action. So hypnosis has been used to treat numerous conditions through the centuries. As an intervention, it can be traced back to the Viennese physician Franz Anton Mesmer, who is also the father of animal magnetism. From what we know, Mesmer came up with a technique of treating medical ailments with magnets, an approach that was, by his standards, neurophysiological. He said he could do with his new technique what Gassner, a traveling exorcist healer, could do through exorcism. He challenged Gassner to a competition and won, a victory of science over religion. It opened up the door to the development of psychological treatments devoid of any religious connotation, and allowed the transition from a religious explanation of symptoms to a scientifically inclined one. Interestingly, in about 1784, animal magnetism became the object of a royal inquiry, led officially by none other than Benjamin Franklin. Its detractors noted that magnetic effects only happened in their appropriate context and followed the expectations of the subjects. Magnetic fluid was rejected as a possible causative agent, and socio-psychological factors like imagination, imitation, and touch were proposed as the basis for animal magnetism. So because of this, the practice was banned by the Royal Society of Parisian Medicine. However, one of Mesmer's students, de Puysegur, noticed that when individuals were magnetized, they were aware of no one save for the magnetizer whose commands they executed. When they emerged from this state, they were amnesic for all that had occurred during the state. De Puysegur used age regression to alter his patient's mood when he found them melancholic or depressed. Because of its resemblance to natural somnambulism, this induced state was called artificial somnambulism. And of course, much later, the English surgeon James Braid coined the term hypnosis to describe this contracted state of awareness. So moving on to the 19th and 20th centuries, so some of the earliest practitioners of hypnosis reported dual personalities, magnetic analgesia and amnesia, post-magnetic suggestions, and age regression, which coincided with the development of dynamic psychotherapy in the last 2 decades of the 19th century. At this time, hypnotic interventions entered new therapeutic models, particularly the theoretically incongruent ones proposed by Bernheim, who used suggestion, and Charcot, who used hypnosis to reproduce amnesias, paralysis, and other symptoms seen in traumatized patients. Janet also used hypnosis, Pierre Janet. So proceeding from the understanding that hypnosis and hysteria were connected, Pierre Janet developed his dissociationist deficit theory and used hypnosis as a primary tool for the treatment of traumatic memories and for personality reintegration and rehabilitation in a 3-stage treatment approach. So this was the golden age of hypnosis. We also know that Joseph Breuer, a family doctor in Vienna, used it. He noted that there was some kind of relationship between a traumatic experience and a state that he believed was much like, if not identical, to hypnosis. He called this traumatic causal experience hypnoid, and was possibly the first individual to recognize what has later been called a state-dependent learning. Breuer also initiated the trauma theory for hysteria and felt that artificially induced hypnosis might give access to causal events in psychological illnesses. Interestingly, Freud also latched onto hypnosis and became interested in using hypnosis for the treatment of hysteria. However, this didn't last for very long, so Brewer stopped working with hypnosis, and both Freud and Jung, gave up on it as well. So from what we know, these two giants, Freud and Jung, were both using authoritative techniques and ordinary conversational hypnosis at the time, and they both found patients reporting traumas that proved to be fabricated rather than factual. Because of this, they came to the conclusion that hypnosis was fairly unreliable. So their stance set the cause of hypnosis back more than half a century because of their great influence within the field of psychiatry. So both these gifted men searched for other kind of more reliable ways of learning about repressed or suppressed traumatic events. Freud, as we know, invented psychoanalysis, which required 1 hour per day, 5 days a week. And Jung, on the other hand, searched for dream content in accessing amnesic material. And of course, Jung's students continue searching for ways of getting through the cloud of amnesia for early life trauma. Jung, as we know, was the father of active imagination and sound play therapy. Backtracking a little bit, we see that what Freud actually did was recast Janet's dissociation as deficit, as repression as defense, and because of his rejection of hypnosis, replaced the technique with the talking cure, so the psychoanalytic method, as his preferred manner of accessing unconscious content. In the 20th century, there was a decline of the use of hypnosis in the clinic in favor of the popularity of the new dynamic systems and the development of the behavioral approaches. Despite the general waning of interest in hypnosis, hypnotic methods nevertheless found a place in clinical practice from the 1920s to the 1940s. So it did come back into favor during World War II for the treatment of war neuroses near the front lines. Also, many dentists were using hypnosis after World War II for relaxing nervous patients. They found it helpful for treating abnormal gagging reflexes, for painless removal of teeth, and for controlling damage to teeth caused by bruxism, which is basically the clenching of jaws in association with troubled dreams at night. So as early as about the late 1950s, behavior therapists, starting with Wolpe, began to incorporate hypnosis into treatments, specifically systematic desensitization, relying primarily on hypnosis for the purpose of relaxation in about a third of the clients or patients. Later, so in the 1970s and 1980s, experts began to write about the use of hypnosis in behavior modification and cognitive behavioral therapy. So despite its rejection by Freud, it has also undergone a renaissance in psychodynamic circles, and it has also undergone a renaissance in medicine, in the field of medicine. So some dentists have continued its use for the purposes previously mentioned, but have also demonstrated its great value in controlling hemorrhage in hemophilia patients. So many doctors have successfully treated hemophilia patients prior to surgery with hypnosis and at the time of already active hemorrhaging. Interestingly, the hemorrhagic tendency, due to absence of the special blood factor, can be blocked by hypnotic relaxation. So doctors who are trained in hypnosis can also teach self-hypnosis to their patients, which protects them against emergencies when a qualified hypnotist isn't available. Fear and expectation of bleeding can precipitate life-threatening hemorrhage in patients with hemophilia. So what can we What does this say? It says that the human mind is capable of controlling hemorrhage of all sorts, including that caused by emotional stress in combination with lack of the hemophilia factor. So that ends my talk on the history of hypnosis. I hope you have enjoyed it, and please join me next time for another video on this fascinating therapeutic tool.